So the $84 million that we've been able to raise have primarily gone into three areas of focus. The first area is on testing. So we've been very active as CACOVID to really purchase some of the Roche supplies, some of the CEPFID, and some of the Abbott testing supplies. Part of the challenge there is that we are competing in the global marketplace. So we were originally on track to only receive, for instance, from Roche, 38,000 cartridges. With our intervention, we were able to boost that number up to 300,000. Part two was we needed isolation centers across the country. Across all 36 states of Nigeria, we sent them enough beds and materials to set up a 100-bed isolation center. And then the third part was palliatives for food. We unfortunately don't have, stimulus packages or safety nets that allow poor people to go and, get a check from somewhere to enable them take care of their day-to-day.
Nairametrics has recently reported that CACOVID has been able to set aside about 23 billion naira to be used for food relief. Apparently we'll be able to help about 10 million vulnerable Nigerians. How is that effort going so far?
What we've done is we decided that it was important to really look at what we call here the bottom of the pyramid. So the 5% poorest people in Nigeria. That comes out to 10 million people, 1.67 million households. And what we decided to do is for each of those households, 1.67 million households, we're going to buy for each of them a 10-kilo bag of rice, 2 cartons of pasta, sugar, salt, gari, semovita, basically the food that we eat here in Nigeria. That's what we were buying for these 10 million families. Part of the challenge was the logistics of it, and the quantities were huge. And we were asking them to do this in a time where everything had been slowed down. So the lockdowns meant that, people were they had to do all these, social distancing and spacing in the factories. They have fewer trucks on the road because of the closure in between states in Nigeria. So those are realistic challenges that we had to overcome. For the medical materials, same. I remember us ordering these respirators for 10 days because everybody in the world was trying to get this. We're getting delivery deadlines of like 12 weeks and 14 weeks. So some of it we were able to circumvent because of our relationships.
Are the foundations that you're working with, including your foundation, doing similar work, maybe through CACOVID in other parts of Africa, or is it just Nigeria at the moment?
So our the way we were approaching the continental-wide effort, which we're part of it, we're talking to the African CDC, we're talking with we're involved with the work that Strav Masiwa is doing with creating the purchasing platform for the continent. So we're involved with what's going on the continent. We have a huge private sector here. I would say, bigger than what we have in most other sub-Saharan African countries. But the idea was, let's get the model together here first. Let's make sure that we know what we're doing and we know how we can replicate this outside. And that's exactly what we're doing. And we're also looking at how do we invest in local, African scientists are coming up with all kinds of things that we need to pay attention to. And right now we're working closely with the African Development Bank, who's looking to fund African-led investments and efforts, and who's making PPEs in Africa that are, up to code. Who's working on a vaccine? Like, let's support those people, because at the end of the day, we have to rely on Africa a lot more than we have in other crises, because everybody's in a crisis right now, and they're looking at themselves and looking on how, looking to solve their own problems and not ours.